Well, with the first weeks of school in the books, Toronto Public Health reminding everyone to get vaccinated and now calling on governments to make sure that happens. A new report urging the province to end philosophical and religious exemptions, also pushing federal agencies to stop the spread of misinformation online. The suggestions come on the backdrop of global outbreaks, but will no doubt cause some backlash, with vaccine hesitancy being a growing problem. A lot of you are chiming in right now. Dr. Vanita Dubé, Associate Medical Officer of Health with Toronto Public Health, joining me now. I'm just going to read out a couple tweets that we've already received this morning. One person, Patrice, saying we need to have conversations on safety of vaccines, mercury, aluminum, and so forth. James saying religious philosophical ideologies should never impede on the health and safety of a population. Two very different ideologies here. Clearly, you're coming from the medical world and the science that says the answer is simple.
Vaccines are safe and they work. And we know that a lot of parents have questions about vaccines. About 20% of parents in Canada actually do. And we know, though, that a lot of those questions are actually from misinformation, from things that they've read on the internet that actually are not true. And so what we need to say is get vaccinated because it protects you and protects others.
When we look at the numbers, about 20%, I think, is what you sourced in your report, that people who have those questions.
Yeah.
And so of those 20%, and I've sat in those mommy Facebook groups where people are posting different articles and different questions, and you want to eliminate that and really just go to the medicine behind it.
Right. One of our recommendations is for social media platforms and search engines to actually be more responsible in the kind of things that people can post and the kind of information that's available on vaccines. Because if someone posts something that's their own opinion, but not based on science, they're influencing other parents out there.
What do you say to someone who says, I don't want to be forced to do something medical to my body, my child's body? You shouldn't have to force someone to do that. How do you respond?
No one will ever strap your child down and force you to vaccinate them. But to attend school in Ontario, you need to either be vaccinated or have a philosophical or religious exemption. We've seen, though, in some states in the United States, that the exemption rates have been extremely high. And if we continue to have rising exemption rates, we will end up with pockets of unvaccinated individuals, and we'll end up with outbreaks of measles. And when you get measles, you don't just put yourself at risk, you actually put others at risk. And so we have to take a public health perspective.
This isn't the first city. Toronto isn't the first to do something of this sort, right? We've seen it in some other big cities where they say there should be no exemptions, right? And what has the result been like that you've seen in some of your research?
Right now in Canada, Ontario and New Brunswick are the only provinces that have these laws. The U.S., they've moved forward with getting rid of non-medical exemptions. And what we're saying in the report is actually we need to start considering it. It's actually not a decision for Toronto Public Health. It's a provincial decision. But we need to start having that conversation. In 13 years, Toronto Public Health's rate for non-medical exemptions has gone from 0.8% to 1.7%. At what point is that rate too high? We need to start talking about that, because at that point we need to actually be able to act quickly.
Doctor, you're looking for another push as well for the future generation. You want this put into curriculum, vaccine education.
That's right. We should start educating children about the science of vaccines, the history of vaccines. Toronto actually has a very rich history of developing vaccines. When we can educate those children in school with science-based information, they will become our future parents, and they'll be able to make informed choices and decisions that they learned about when they were in school.
Okay, so lots to discuss. So this will be taken to the Board of Health next week, and then potentially taken to Council if the Board of Health says we want to have more discussion.
That's right.
Yes.
Yeah.
Okay, so a lot more to come. We appreciate your time. Thank you so much for this. And
You're
you
welcome.
can always chime in with us at BT Toronto on Twitter.